research across the federal government with emphasis on science and evidence-based programs with the aid of a newly established chief medical director. This is new. This stuff is new. This hasn't been in place. We've got 2 professionals now. We wanted the Assistant Secretary of Mental Health to be a doctor. That didn't come up. That was part of our original plan in the HR 2646 because we found it vital that this individual had to have some kind of medical background. We don't want just anybody there that's got a good popularity or is Trump's best friend to be put into that office. We need someone with some science behind their knowledge, and this is what we didn't get, but we are still working on that. You know, just because we didn't get it now doesn't mean we won't have it later, especially with what we see, the necessity of it coming up our way. So we're very encouraged by that as well. It establishes a new federal policy laboratory, okay, and it's for mental health and substance use to evaluate and elevate and disseminate policy changes and service models that work based on evidence, research, and science. Okay, and also it's going to have funding and strengthening evidence-based treatment programs for severe mental illness. It strengthens and expands critical assistant outpatient treatment programs to help break the revolving door cycle through a grant reauthorization and funding increase for states to implement AOT, and permits states to use Department of Justice grants for funding for AOT. So a lot of these counties don't know this. You know, we're in San Bernardino County right now fighting for Laura's Law and AOT because we don't have it there. And as the director told me the other day, oh, you know, our geographical area is different than those other counties that have implemented it. It's going to be a little bit more difficult for us to implement this law where it's going to be effective. I said, look, stop talking. Let's not go down that route. You don't know what you have available for you yet. 13 other counties have already implemented this law. It's a matter of time of when you're going to have to do this as well, especially with this new Cures Act in place. So we're going back and forth. She's telling me what's in place is working. I'm telling her if it was working, I wouldn't have this scar on the side of my face or on top of my head, or my wife wouldn't have the slashes that she has in her body as well. So it's not working.